Welcome to Speaking of Pets.
We're the Novotny sisters from Cleveland, Ohio.
I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist.
And I'm not. I'm Janet Novotny-King, the doctor's sister, podcast co-host, pet owner, rescuer, and lover.
We're here to provide pet owners with science-based information to help them be the best pet parents they can be.
Here's today's episode, created just for you and your pets.
This episode of Speaking of Pets podcast is sponsored by Froggy's Golf Ball Retrieval. Don't use a mulligan. Let Froggies clean up your ponds while the golfers clean up their game.
Hey everyone, today it's all about integrative medicine. Acupuncture, herbal medicine, water therapy, you name it. We have our go-to integrative person, Dr. Neal Sivula, an OSU graduate, Ohio State, not Oklahoma, Ohio State University. He also, besides having his veterinary medicine degree, has his PhD. I'm not going to list all of his accoutrements, but I will tell you that he was inducted into the Animal Chiropractic Hall of Fame in 2023 and received the Lifetime Achievement Award from the American Academy of Veterinary Acupuncture in 2024. So we got the right guy, Janet. We got the right guy to talk acupuncture today. And not only is Dr. Sivula an integrative veterinarian, but we're also neighbors. So our practices were diagonally across each other. So, you know, we put up with the same stuff you have to put up with at Chamber of Commerce meetings in small towns. Welcome, Neal. It's great to have you with us today.
Thank you. It's great to be here.
Before
I'm
we start,
a huge believer in alternative medicine because everybody heard this 100 times. I had Lyme and Bartonella and suffered for about 5 years. And if it weren't for alternative medicines, I don't know where I would be.
If it weren't for a veterinarian, of which she's related to, and a chiropractor, that actually
Five
furthered that
MDs I went
correct
to.
diagnosis, yes.
Yeah.
Actually, my internist did diagnose me.
Yeah.
He did, but the other...
After we told him. So what is the temperature in Richfield, in Akron today?
10. We just made it to double digits.
Why do you ask us that question? Just because you want
Because
to...
I'm in Florida, but it's chilly. Look, I got the sweater on.
Right now, let me tell you, it is... I'm in Connecticut, Neal. It's 23, but it feels like 12.
Okay.
Oh. Well, I'm going to start because I want to get down to some of the basics because Janet, we get a lot of questions about acupuncture.
We do.
But Neal, just what is acupuncture?
Well, we could say simply that it's stimulation of points on the body, whether it's with a needle or through other methods that we can discuss, to have the body respond.
Want to discuss those.
Yeah, to have the body respond and help us treat any medical condition.
So is it more nerve stimulation or lymphatic or blood flow or all of the above?
I'm going to ask, what do those needles do?
Okay, well, we could get to that. But to answer your question, Alice, it's all of the above. And the more we know about the science, the more we expand what we think about or what we know about what happens when we stimulate those points.
I think that's fascinating. I've been reading in Nature magazine lately about how tumors have a neuro component. Mm-hmm. And you shut that, like example, vagus nerve. And same with autoimmune disease. You know, they're doing vagus nerve, what is it, stimulation for rheumatoid arthritis.
Yeah.
It's fascinating.
It is.
It really is. And I think you're right. I hate to use the word one health holistic, but it seems like diseases are that. It doesn't just involve blood flow. It involves every body mechanism.
You bet. Yeah.
So as a pet owner, say I think Libby, my golden, needs acupuncture. How do I find you? Do I go to my regular vet?
That is a great question. And unfortunately, there's not a clear-cut answer because there's a number of training programs in the U.S. right now, and they all have their own role of graduates. And we have a few national holistic associations, and Alice mentioned the one acupuncture group, the American Academy of Veterinary Acupuncture, and that's actually a subsidiary of our international group. But and that's the group that I did my training through. But another person may have done, the Chi Institute is in Florida, and they have their own website and their own role of graduates. So normally when a client would ask if they have a relative out of town, or if they're going to be in Florida for the winter by chance, we will send them to about 3 or 4 different websites. Just
cool.
the different training groups and holistic associations, just so in case we can catch someone who's a member in one place but not another, and to try to give some
Right.
broad coverage. I wish we had a better system, but we don't.
Well, our derm college, you go on our derm website and you click on find a dermatologist. I'm sure it'll evolve into that for you.
I hope so, and you may or may not be aware that we're trying again to have acupuncture recognized as a board
I
specialty.
am aware.
So, and
Yes.
if that does go through, then we will have at some stage diplomats,
Yeah.
and of course we'll have a locator that way. But that won't encompass all the veterinarians that do acupuncture, because only a certain fraction of veterinarians that do acupuncture will go on to try to become board specialists.
That's
So-
true.
I bring my pet in for treatment, and depending on their diagnosis, am I coming to you for treatments for a long period of time? Is it for, and I'm sure it depends on the diagnosis, but am I bringing my pet for a lifetime to you, or is it a certain number of sessions? I mean, how do you know when to start and when to
It
stop?
probably depends on the disease you're treating,
That's what I
right?
was thinking.
It very much does, and you guys know from our previous conversation that most of our patients are geriatric, so they're in for the long haul. But Janet, to your question, it would depend. Say a dog that has a vestibular problem, an acute neurologic problem, we may only see them a number of times and then they're done.
Wow.
Or we see a young dog that's had an accident or an injury and we treat them for a while and then we see them when they're older.
Wow.
Yeah.
Now, go ahead. I was reading, there's different types. There's laser stimulating. Go over those, Neal, because I was not aware until I looked that up.
Yeah, sure. So, the tradition is to use a needle, an acupuncture needle, which are small, they're small, very tiny needles that are put into the acupuncture point. And that's what everyone thinks of when they think of acupuncture. But you mentioned laser. I do most of my acupuncture with a laser. So it's pain-free for the pet. Makes everything a lot smoother. We can use our fingers, acupressure.
Okay.
We can use, there's a device in Chinese medicine called a teishin, which is kind of like a ball. It's a very delicate instrument, smaller than a ballpoint pen, but it just has a bit of a blunt, maybe nothing that would cause pain, but a small tip on it that you can use to stimulate the point. We can use injection. Some docs will inject B12 or saline into the acupuncture point. Any number so we've got a lot of options. We can use electrical stimulation on the needles. That can provide a different effect as well.
Whenever I think about acupuncture, I think about, gosh, how do you do it on a cat? Because cats hate coming to the vet, A. B, although when I would skin test a cat, people are like, you're not going to, we never anesthetized a cat. They're more afraid of the clippers of shaving a little hair than they were of me doing intradermal skin tests. So is that same for you with cats?
Let's face it, cats, it has to be on their own terms.
You got it. You got it. So yes,
You make house calls, Neal, for cats.
I should because it would be a lot easier. Some cats are very receptive that don't mind the needles, like your experience with testing.
Yeah.
But I use the laser a lot because I use a lot of points down on the feet, and nobody appreciates the needle on there.
Yeah, that's true. Wow.
Yeah.
They just don't like coming out of the house. I mean,
Right. Yeah.
Golfers always swing for the greens, but they don't always hit them. Every year, millions of innocent golf balls are recklessly sliced, chunked, and hooked without any consequence. Golf balls can have a significant impact on the environment if not properly removed from ponds and water hazards, harming aquatic life, contaminating water, disrupting habitats, and aggravating golfers. Plus, golf balls do not biodegrade and can take 100 to 1,000 years to break down. Once they do degrade, they release microplastics, zinc compounds, and rubber fragments. That's why Froggy's golf ball retrieval service is so valuable to the sustainability of golf courses throughout the Midwest. Froggy's efficient retrieval system helps reduce environmental contamination, waste, conserves resources, and enhances the golfer's experience. Plus, they offer financial benefits. Froggy's pays per ball for any golf ball pulled from your ponds, no matter the condition. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube. where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jameela and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
Okay, so I'm hearing about needling. How is needling different from acupuncture?
Dry needling?
Yeah.
Like in people? Okay. So it's a theoretical difference. Well, in people, it's a training difference as well. So a licensed acupuncturist for people is trained for years, 3 to 4 years. They have doctorates in Oriental medicine now. And so those docs, to be a licensed acupuncturist, you've got a multi-year degree, where someone who's trained to dry needle may only be trained for a number of hours, unfortunately.
Well, that football player, did you hear about that, Neal?
Yes.
He got a pneumothorax. I mean, those
Yes.
needles shouldn't be going in that deep.
What's a pneumothorax? Something in the throat.
No, he couldn't breathe
Yeah.
because
Air,
punctured his lung.
Yes, air got introduced into the chest. So there's the difference: is you've got someone who's their training maybe didn't include enough to the safety aspects. And so back, Janet, to your question, dry needling is putting the acupuncture needle into a painful point, what we would call a trigger point. So when your therapist, massage therapist, chiropractor, physical therapist finds this painful point in a muscle, that's where the needle is going. As opposed to acupuncture, where it might go in that spot, but our acupuncture points are based on location, not always on discomfort, on palpation. So the application for dry needling is a lot smaller than acupuncture, which has a broad application for health.
Where do you see the best success rate?
Like what disease?
We generally, probably like dermatology, the shorter course of the disease, the more rapid onset, the faster we can turn it around. So, I used the vestibular disease example earlier, maybe a strain or a sprain. Those can be easy to turn around. But then you have the 14-year-old golden who comes in who's had arthritis for a year or 2 years. And unfortunately for us, we talked last time, those dogs are sometimes coming to us when they've tried everything else, and then we have to try to turn them around, and that's where it takes a lot of good communication between us and the pet guardian to know what they're in for. But going into those sessions, we provide some expectation. Like if we're not getting a response in this many sessions, then we ought to think about doing something different.
Well, and it's hard on you because you are the last resort. And they think just the one thing, this acupuncture is going to cure him, when it's multifaceted. Really in any disease, it's multifaceted. Whether it's arthritis, like in a 14-year-old, or allergy that I treat, there's not one silver bullet, if you will.
No,
Sadly.
And I think the thing that you could appreciate, at least over my career, is that clients and primary care veterinarians and specialists, we've all evolved to a team concept where there's less territory, worried about territory, and I do my thing, the general practitioner does their thing, the specialist does their thing. I mean, we've got pets that come in that have 6 different dogs,
Yeah. Well, and look at in human medicine, and those docs don't talk. We talk in veterinary medicine.
Yeah.
I'm sure you get history sent to you like this, like I've got like 5 years of itching, and I'm reading these histories. I love when we go to the physician and we have a long history, especially you, Janet, and they didn't read that history when you heard this door close and your door open.
Yeah.
I'm impressed when they do. When they come in and say, wow, I see that. And I'm like, okay, you read about me.
Yeah, I am impressed when they do.
I'm very impressed. And I bring like a 3-page dossier.
Yeah.
At least they come they come electronically now by PDF instead of by fax machine.
That's right.
And here's my favorite question when you reach a certain age. Are you sure you're not on any medications? And I'm like, positive. I never go to the pharmacy unless it's for a hair product. I'm like, honest to God, they ask you 5 times in a session. I'm like, really? I'm not,
What other diseases do you like besides, let's talk about dogs first. So you see a lot of senior dogs with mobility issues. What else? And the vestibular. You know, it's interesting because here in Florida, another person that fosters dogs from Golden Treasures Rescue, their dog just went to ER the other night, their older dog with vestibular.
Yeah.
And so explain that, would you, Neal? Because vestibular, first of all, what is
when you have a
vestibular?
vestibular episode? They're kind of like woozy.
Yeah, clients they think they're having a stroke. The dog is disoriented and is wobbly and falling. And our hallmark, of course, clinical sign from the dog is that their pupils are moving side to side very rapidly, and that gives us. And sometimes it can be an inner ear issue, but a lot of times we just don't know what causes it, and it takes medication. We do a lot of acupuncture, some chiropractic, and a lot of patience and love, and hopefully we can turn those guys around.
So I keep seeing ads for stop smoking, come in for acupuncture. What's your opinion on that?
Some acupuncturists are have very successful practices doing that. Some don't fall into that, just treating that one thing, but it can be helpful.
So does it stop the addiction?
The cravings. Yeah.
Wow.
Are there any adverse effects that you see from acupuncture in dogs and cats?
We
Has
occasionally
anyone thrown up or something?
Occasionally, very, very rarely, a patient might worsen. Their condition might
Really?
worsen. Yeah, it doesn't happen very often. It happens more with herbal medicine than it does with acupuncture. We might get localized bleeding at where the needle went in. Again, I can't remember the last time that happened.
Yeah.
I think the biggest thing is that we prepare clients for what to expect. And Janet, you've gone to physio, so you remember. I mean, you get sleepy from the endorphins that happen with a treatment, and that's something we tell clients: expect the pet to be sleepy. They won't be sore, but they could be sleepy. And as long as we prepare them for what to expect, they won't be surprised if it happens. And so the day of a treatment, we expect the pet to be sleepier than normal. And
I usually don't tell you, like, just tell me what to expect. Maybe it won't happen, but at least if it happens, I know, like, I'm okay, or the pet's okay, right?
Right.
I'd rather be prepared.
exactly.
Yeah.
How long does a session take?
Oh, yeah.
A session?
Yeah.
When we use needles, those needles are in 15, 20 minutes. When I use a laser, it's very quick. We can be done in 5 minutes or so. That's another benefit of using the laser, is that it's very quick. So for those
Like lunch hour.
for those cats that don't want to be there, we can get done and get them home.
Quick as a treat.
Yeah.
Do you do like donkeys and horses? What's the most exotic animal you've ever used for acupuncture?
Gator.
Rabbits. We've done rabbits in the office, iguanas,
Iguana.
Canada goose.
Really?
done-
Like
yeah.
with a leg problem or what? What was the goose?
Yeah.
Was it a pet?
Yeah, it was a pet. Yeah.
Oh, I would love that.
Yeah, we've done a duck.
Really?
Well, the iguanas are falling out of the trees here in Florida because it's cold. I'll send them over there with their back problems. Now, what about water therapy? Because
Yes.
a lot of people don't have the water therapy tanks. They're very expensive. Mm-hmm. So you use that in conjunction with acupuncture, or two different things?
Oh, we do. It would be in conjunction because, as you said, things are multimodal. We're using a number of different therapies for every pet. We're not just limited to the acupuncture. So, we've got a pet with mobility issues, with arthritis, neurologic problems. We've got a really great little pit bull from the Cleveland APL coming in now, and he had some birth defects, and so he had one of his front limbs amputated, and then the other one just had a corrective surgery and a growth plate, and he's been doing a little swimming in the tank to keep that other leg strong. And so
I would love.
Yeah.
Could you give us a video of that? I would love to see him.
I will get a video for you. Yes.
Good. I would. Now, tell me about putting cats in the water tank.
We do it occasionally, not very often, but we have. Yeah, some cats do okay with it, and some cats initially will just reject it out of hand. Years ago, when I first started with my first unit, I had a cat, and I think I did 10 sessions with him, and then on the 11th, he just decided he was going to just drown himself. I mean, I saved him, of course, because I was in there with him, but he just decided, I'm done with this, and I'm just going under. Yeah.
So do you use a lot of catnip? Seriously.
Yeah.
But
I
they're
bet
not
you do.
all turned on by that. You told me that.
It's genetic, right? Not all of them.
Right.
Yeah. Wow.
You need a responder,
Interesting.
but yeah. Whatever we can do, whatever trick we can pull out, we're going to use
Well,
it.
speaking of catnip, now let's talk about herbal meds.
Yeah.
Because my concern with herbal, I'm open-minded to anything. I like combination Eastern Western medicine, blah blah blah. But I worry, how do I know the herbal, well, first of all, you probably should get it from your veterinarian. But how do I know if I'm a pet owner and I'm ordering an herbal product from Amazon? How do I know that's not contaminated with, heavy metals, or where it's coming from? Give us some advice on that.
But the bottom line is you don't know. And even some of our companies that that are for veterinarians only, so those products can find their way to the black market, so to speak.
Yeah.
And the unfortunate thing is when a person buys that, it may be not that product. It may be relabeled as something different, and so it's pretty risky.
Wow. Now they're doing a lot of studies revisiting plants for drugs.
Yeah.
And I love that because it's better than synthetic. But having said that, how do we know we're getting the pure form of that plant when we get it? Well, for example, doesn't China make 95% of our vitamins?
Yeah. Yeah.
And not everything you get from China is bad. I'm not saying that.
Yeah.
But I'd like to see the data on, can someone be checking that for me? You know what I mean? When it's coming into this country. Well, Consumer Lab, we had Dr. Cooperman on.
Yeah.
And they do, they pick stuff off the shelf, and they've actually got, well, Janet, our Dove chocolate has cadmium in it, high levels. I know.
Yeah.
I mean, who'd have thought?
Yeah. You just don't know.
You
You look
don't
at some of these athletes that test positive for illegal drugs that have snuck their way into their supplements unless the supplements are independently tested. So I can imagine what goes on in our world.
Do you ever have pets that are sensitive to the needles somehow, like an allergic reaction?
Very, very rarely.
Okay.
Very,
So
very
I'm
rarely.
assuming they're stainless steel or copper. I don't know.
Yeah, the needle can be coated or uncoated, and sometimes the coating, a pet or a person can have a reaction to the coating. It's a pretty rare event, a very rare event.
Okay.
Yeah.
Just curious.
Huh. So do you see a lot of police dogs? Because they're very athletic.
You mean shepherds?
Police, huh? Yeah. Well, shepherds or Belgian Malinois.
Malinois, yeah, we've seen a number over the years. Yeah,
'Cause
because
they
they
are-
are extremely athletic. Yeah.
They are built, Janet. I'm going to tell you, they're like a mean, fast missile machine.
Well, that's their job.
I know. I respect them totally. But what do they get? A lot of hip problems or elbow problems, or what do you mostly see with them?
You bet. Low back problems too from jumping in and out of the vehicle. Yeah.
So do you recommend home treatments or diet along with the acupuncture treatment?
You mean like physical therapy at home?
Well, no, but like maybe there's a food that has a higher concentration of X in it. I don't know what. Or I don't know. Is there, as a pet owner, like, okay, I take Libby for acupuncture and she's doing great, but are there other things that a pet owner could be doing at home depending on that canine's condition?
Oh yeah. We talk about food. We've got, we're sending supplements, of course, and then some exercises and other things. Anything that we can do to help that pet get better, we're going to do. And clients want to be involved. So, we can arrange for them to have a laser at home to use on their pet. So we pull out all the stops to make sure that they're getting everything that they
Do
need.
they buy the laser? And explain lasers, like cold laser? I'm confused about that, really.
Sure.
'Cause-
I feel like it's very Jetson.
It's based on wavelength, the wavelength of the light. So the company where we have an agreement with, it's a red light, so the clients actually see the red light when they shine the device, and it's completely safe. They don't have to wear goggles like some of the higher powered units require, and it can be a rent to own situation. So if we know it's a short term thing, they pay by the week, and if they have it long enough, then they automatically own the unit, or they may just opt to purchase it outright in the beginning. What's nice is we get, at least, especially in the last year and a half or 2 years, a lot of clients will come in and ask, they want to buy one from Amazon. Can I buy this laser?
Oh boy.
And I say,
What's your opinion?
Well, it depends on the unit, but again, just like the supplements and things, we've got to vet that pretty carefully. And it's nice now that we have a relationship with a unit that we know and trust.
Yeah. Isn't that the truth? Because there's so much counterfeit stuff, and
Yes.
you're only as good as your marketing when
Yeah.
you're buying stuff online. You know, how sad is that? You know, Janet, I know Neal would agree with this. I've seen people waste so much money on products that we knew weren't true true to the ingredients listed on the label. You know, that's just it's so sad. It's
But
so
I
sad.
also find when I'm shopping, and I'm using Amazon because who doesn't shop on Amazon, right?
Yeah.
When I'm shopping on Amazon and it looks like the filter I got for my humidifier,
Oh.
but it's not the brand. Like I'm thinking it's 3M, I'm making, whatever brand. And then you look, I'm like, wait a minute, that's not it. It's, like it's kind of tricky the way it's it's kind of like bait and switch.
Well, even the packaging, they are
Yes.
so good at making it exactly like products that we would sell as veterinarians.
Yeah.
And actually, I just read here in Florida, a husband and wife couple in business were selling counterfeit veterinary products.
Yes.
Well, it took them years to arrest them. I mean,
Yeah. Yeah.
Well, even
And
my
you've probably seen the on Vin about these. You see these ads on social media now that endorsed by a veterinarian, and of course it's not a veterinarian.
right.
Yeah.
There's a guy on our AM radio that's pushing some kind of dog food, but he never says veterinarian. He never says. He said, "I wrote a book, and an Amazon bestseller." And, I'm like, and
anybody can write a book these days. But Neal, did you see? I'm not going to name the name of the lab because, I do know what it is. They're selling over-the-counter cyclosporin. Our derm college, of course, is all up in a swivet about that, which they should be. But it's by Dr. Allegedly a doctor, a veterinarian, saying, your dog Apoquel doesn't work, blah, 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 doesn't work. This works, and it's cyclosporin, allegedly.
Yeah.
Golfers always swing for the greens, but they don't always hit them. Every year, millions of innocent golf balls are recklessly sliced, chunked, and hooked without any consequence. Golf balls can have a significant impact on the environment if not properly removed from ponds and water hazards, harming aquatic life, contaminating water, disrupting habitats, and aggravating golfers. Plus, golf balls do not biodegrade and can take 100 to 1,000 years to break down. Once they do degrade, they release microplastics, zinc compounds, and rubber fragments. That's why Froggy's golf ball retrieval service is so valuable to the sustainability of golf courses throughout the Midwest. Froggy's efficient retrieval system helps reduce environmental contamination, waste, conserves resources, and enhances the golfer's experience. Plus, they offer financial benefits. Froggy's pays per ball for any golf ball pulled from your ponds, no matter the condition. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry. And I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jameela and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
So Neal, what made you go? So you have your veterinary degree. What made you go into the alternative medicine route?
I was injured playing football in high school, and I had back surgery.
Which high
And
school did you go to? In
Painesville
Akron?
Riverside.
Oh my God,
Yeah.
Euclid High School.
We're Euclid.
Euclid
Yes.
High School Panthers.
And I had
I
lingering
don't think
pain.
we played you.
No.
I
No.
don't think we played. You were too far. We were Lake Erie League. What were you?
Shoot.
Akron Canton or something.
No.
Painesville is way east by Ashtabula.
NEC, which
Oh,
I
okay.
don't think exists any longer.
Yeah.
So you were injured playing
Right.
football.
Yes.
Oh, and that got you into alternative.
You know what? We've had several guests on the show that are doing what they're doing now because of a personal injury and gone to so many human doctors, never without success, did some reading on their own, and bingo.
Yep.
Yeah.
Yeah.
So true. Well, one gal we had on, she had Lyme disease. Cleveland
Yeah.
Clinic diagnosed it, but they would not give her more than 2 weeks of doxycycline. She goes all the way to Albany, New York, and she bought herself a hyperbaric oxygen chamber.
I can see why. Because you
Do
get
you
to
have that, Neal? Hyperbaric oxygen yet?
We do not.
I bet those are like $80,000. I
They're
mean,
expensive. Yeah.
yeah.
you'd have to have that pet lion in there a long time too, for treatment, wouldn't you?
I don't know. Do you?
What?
In the
It laying-
hyperbaric, the treatment time, don't you have to lie in that thing?
Oh,
for-
yes, yes, yes.
Oh, you do.
There's yeah.
Hey, getting back to laser. So when
I thought
people,
you were yelling to the dog, get.
yeah, no. Do people use that laser on themselves when you send it home for the pet?
Yeah, I think they do.
Probably.
Yeah.
Because I had a client taking Revolution.
Oh gosh.
'Cause she thought she had bugs crawling out of her skin. And to be honest with you, Neal, now that I know what I know, I bet she had the Lyme disease neurosis.
Yeah.
I really do. She had 2 pugs, excellent health, except they weren't spayed. And she would bring in a Ziploc bag little, what she said, they're threads or bugs.
God.
But having said that, on our veteran listserv, someone else had the same problem, another
Wow.
dermatologist. So
But
I
I'm
had to put in
telling
my
you-
2 cents.
When you have Lyme, in my case, those, what are they, spirochetes, what are they called?
Spirochetes.
Spirochetes. When I went to
Janet, good.
well, they were all over my body. They were in my body, right? But the
Oh, the
questions,
thought of it.
they were 100 questions, Neal, that they ask you, and I'll never forget the wonderful Lyme doctor. He goes, so have you found yourself using profanity? Like exceptionally, and I went, actually, yes, because it was COVID and I could have a mask on and I could be like, and nobody knew what I was saying, right? Like at the grocery store, like, out of my way. So, and I'm like, actually, yes. And then it was, have you developed OCD tendencies? And I was like there would be a speck on the floor, and until that speck was picked up, I could not
Yeah.
rest. And I
Yeah.
never was like that. So I
Yeah.
really feel for the people who suffer from it, but it
Yeah.
really does affect you mentally.
Yeah.
Well,
Like-
let me put a plug in and for Dr. Ed Breitschwert, who we had on the show,
Yes.
a Bartonella extraordinaire expert. He just came out with a book
Yep.
about Bartonella and its possible relationship to autism.
Ah.
Couple of facts. When autistic kids are put on antibiotics for whatever reason, their autism improves. And 45 to 50% of mothers of autistic kids have some sort of autoimmune disease. I'm only on like the 3rd chapter it's on Kindle and I can't put it down. It's so fascinating. He's not saying everybody autism equals Bartonella. He's just saying let's work them up for it, because if that's a physical reason behind it, we can treat that.
Yeah.
We just had, we have a Facebook page here where I live, and it's a bunch of moms, and you can ask for referrals and advice, whatever. And a mom went on and said, I've had, I can never say it, tinnitus, which I got when I had Lyme. And she said, I have this tinnitus I can't get rid of. I've been to the ear guy, I've been to la, 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 la. And I put in there, go get tested for Lyme. And if the doctor's office test doesn't, comes up
Yeah.
negative or positive, send it off to Hygienics or one of the other labs. But I don't think people realize that there's a connection.
Oh, every body system to,
Yeah.
to that.
Yeah.
It just hangs on for good. Do you
I have a friend that
see
went
many,
deaf in one ear.
Neal,
because-
do you see many Lyme arthritis dogs or no?
We do. We
Do you? Oh,
Yeah.
that's scary. Wow.
Wow. Oh, sorry.
Yeah, Janet has construction going on in her house.
I'm like my whole chair is right now. And I checked because Libby is usually by my side because it's kind of upsetting to her, but she must be in Donald's office now. So
The other thing I wanted to mention, Neal, what is that herb that they use in hemangiosarcoma? I can't remember, for the bleeding.
Unin Bio.
Yes. Remember a little while back, that was being contaminated
Yes.
with something that started with an A, not arnica, but something like that. And I thought, oh my gosh, here we're using this because we need it for these dogs with cancer. And then it's being contaminated by some, I guess, raw drug person. I don't even know who was doing contamination.
Well, the company, it's a Chinese company, and they don't disclose the exact recipe or constituents of it, which is a
Okay.
big red flag. But it's worked its way into mainstream medicine, and they're a Norwegian equity group. I think that maybe has investment interest in them. Anyway, they identified that there was pangolin scales in some of the company's products, and so we don't trust Unum Bio any longer, and we won't. I won't support a
Right.
company that does that sort of thing. So we use a different herb instead of that. But
Okay.
you're right. Unum Bio has made its way into mainstream medicine and is used
Yeah.
extensively. But I just have ethical and
Oh.
scientific reasons for not using
The
it any longer.
pangolins, that issue is, don't even get me started on that.
Yeah.
So how are you checking? Is it your integrative medicine group that you exchange ideas when you hear about contamination of a product, or kind of like we do in derm? Yeah.
Exactly. Yeah. Yeah. That word spreads pretty fast.
Yeah, doesn't it? Bad
Yeah.
news travels fast,
It does.
as it should for something like that.
Yes.
I want to know about your online Buddhist seminary.
Oh. Yeah.
That is like super cool.
Yeah.
Tell
Yeah.
us. We want
I
the
was-
link to that.
Okay. I was at a conference with a friend, and he was mentioning that he was going to do an in-person Masters of Divinity. And I thought, I'd been meditating since vet school, because you got to get through somehow. And
Remind me to
and-
tell you something about meditation when you're done. Go ahead.
Okay.
It's
So I came
contaminated.
home from that conference, and I looked online, and I found an online seminary, and so I enrolled, and I've got a Master's in Divinity from them.
That is so
So
cool.
cool.
There was just a study in Nature magazine, which when I get it, we get our mail like a week late here. I'm like, oh. They compared for people that have had cardiovascular disease, have had a heart attack. And so what perpetuated their lives, they did 3 groups: meditation,
Yep.
diet, and exercise. The ones that lived longest were the meditating people.
Yeah.
So fascinating.
Yeah.
Yeah. That is so cool. And I would believe that about him, because one time I was in the post office behind him, and I was like, I was like coming off a really busy day. My eyes were circling in my head. And this very nice person in front of me turns around and he said, "Hi, Alice," in the most peaceful voice. And I thought, calm down, And then I didn't realize it was Dr. Sivula till I got in my car, because I was still kind of, got in the car. I'm like, oh my God, that was Dr. Sivula. I didn't say hello. He probably thinks I'm horrible. But it was the most peaceful. Yeah. So there.
Well, wait a minute, because we have all this snow here, Neal. I'm sure
Yes.
I'm in Connecticut, you do too.
They have more snow than you, Janet. Ohio.
Well, I'm driving my car, and the whole thing is going like this when I got to 35 miles an hour, like the whole car. I'm like, what the hell? So then I drove home, and I said to my husband, what is going on? He goes, well, you probably have snow in the wheel well. I felt that yesterday. I'm like, well, why didn't you tell me? But how do I get it out of there? And I Google it, and it's like really bad for your car. So I had to go to the car wash. Well, everybody else had the same problem. I was at the car wash for an hour. In 14-degree weather, and I got in there, and I thought, okay, I'm just gonna make this a peaceful moment, and I just kind of like, because what are you gonna do? I had to have it done,
Yeah.
but and so I kind of watched the cars. Yeah.
Well,
But anyway, so I got it fixed, but it was very stressful, to be honest.
Yeah.
Well, speaking of stressful, when some pets are so stressed,
Yeah.
having to go to the vet, do you ever do house calls? I mean, I know you don't have the time to do it. Because a house call takes a long time. It does. Especially if you have to chase the cat around the room. Mm-hmm. But have you ever had to do that? To not chase cats around the room. We've all done that. But I mean, had to go to the house because like an elderly owner couldn't bring their German Shepherd in.
Yeah, we just haven't had the time. I haven't done house calls in years. One thing that we do, it's kind of is to see some pets in the car.
Yes. Good idea.
We get some large dogs, and it's just
Yeah.
too much of a hassle to get them out of the car and get them into the office, even though it's a short walk. It's just
Yeah, I know.
so and they've got mobility problems. So it's just they're in the car, they're comfy. I just go out to the car and crawl in the car.
Hey, you know what? I know you. Is the masseuse still working at your office?
yes, we've gone through a couple, and we've got one of our original ones back.
Well, Janet, what else I think we should talk vitamins
Because
because
I have one more question though.
Yeah.
Is there any situation where the pet comes in and you know it's not going to make a difference?
oh,
The treatment.
there's always hope though.
I agree. There's always hope.
I think we can never say that we're not going to make a difference. I think we can say, with certain problems, we're not going to get improvement. Maybe we're going to stall the decline, or we're just going to make him feel better. We were talking earlier, and one thing I've really come to recommend to most of our new clients is I recommend some therapeutic touch for them to do at home, just to make that pet's life better.
Yeah.
And the client loves to be involved, and I think it does wonders for both parties.
Yes.
And so, yeah, can we, if we're looking at it strictly, can we fix the disease? Sometimes no, but we can just make their lives better, make everybody's lives better.
And how do we not know that you're not transferring energy? Right? How do we not know that? I mean, seriously, I'm a believer in that. And having said that, Janet, in my neck of the woods with allergy and dermatology, I remember having a middle-aged to older Cocker Spaniel in, and Neal, you would appreciate this, with the ear that looked like cauliflower, the overgrowth. You couldn't even get, and I started treating it, and I said to the owner, let's try it. Do you know on that recheck in a month, that was gone?
Yeah.
I've always remembered that. And the dog was so nasty because it was so painful. It was like a new dog.
Yeah.
I couldn't believe it. So having said that about, well, do you think it's not going to work? I've never thought that because there's always one. It's just like, Janet, when Daddy had cancer, there's always one that defies the odds. He lived 11 years after that surgery. Nobody does that.
It was heavy duty surgery too.
And he might be the one. That pet might be the one. So they're coming to Neal. They're coming to me for hope. And by the way, Neal, I'm volunteering with Silver Snout Senior Dog Rescue here. It's all these little dogs with mammary tumors because numbers spayed. And listen, they want to live. The will to live is there.
Yeah.
I would, if I went to a doctor and they said, nah, it's not. They did a study that proved, well, doc, how long do I have to live? 3 months. 3 months. That person with that condition, you can't say that because you've got to have persistence and hope. So, yeah, I appreciate that question. But I think both Neal and I are like, we're going for it. Yeah.
I think, Janet, the number one thing that clients want to know is, are they uncomfortable? And if we can say we're doing everything we can to keep them comfortable, they'll go 1,000 miles. They'll do whatever.
What about like a heated blanket?
Yeah.
Do you ever use like thermal? Explain that.
Yeah, we got to be careful. Of course, about burning, but we use a lot of heat. Yeah, we use a lot of heat therapy. So, dog blanket.
Like stuff you put in the microwave, or if special dog and cat stuff.
Well, I love the packs that go in the microwave. We got to use those with caution, but we never use an electric heating blanket for people because those are,
Never.
But the microwavable packs, love them. Nobody has a hot water bottle anymore except for us, I think.
I do.
Yeah,
I do.
yeah.
I used to have cramps.
Yeah. Hot water bottle is awesome. Warm water and a towel. We're doing all of that because it can be really, really helpful. And on the acupuncture side, I think last time we talked about moxibustion, and that's a Chinese herb that comes either loose or it's rolled into a cigar-like thing, and that's how we normally use it. And it burns at about 240. So you light it, and you can hold it above the acupuncture point, or we can just use it more generally just above a sore area, and it drives heat into that area. So that's something we could send home with the client to have them do.
Yeah, yeah.
Yeah, and there's medicinal qualities from the odor from the moxa as well.
Wow.
And that,
I was going to ask you about aromatherapy.
Yeah.
Yeah, yeah.
Well, the traditional moxa, I was just going to finish up with.
Smells
like cannabis. So you gotta.
Oh,
Yeah, they make it.
by the way.
Yeah, they make a smokeless version.
So you're fine.
Yeah, they make a smokeless version that doesn't have that scent. It doesn't medicinally. We don't think it's as good, but a lot of clients maybe don't want that odor.
Do you, speaking of CBD, is that a good part of like a mobility prescription for some of these dogs?
We use it a lot. A lot of clients have already started it. I
If you
try
get
to
them on the right one, let's face it.
again, quality and dosing, and for a larger dog, it can be really expensive, and we don't want to jump to that and overlook some more basic things that might be helpful for the cost. We're always trying to, spend the client's money reasonably.
So true.
Yeah.
Yeah, so true. And I think it makes us think out of the box more. I mean, if I were a human physician and I could check off any tests to run, but we've got to get the biggest bang for our buck,
I heard something a few weeks ago, and you'll agree with this, is that as veterinarians, we thrive on working with incomplete information.
Oh, so true. Janet, I should needlepoint that. I'm serious.
Seriously,
That is so true.
Because the patient can't talk.
Number one, they can't talk. Number two, we're not in their homes seeing what kind of lifestyle they have.
Right. I can't imagine.
We may not get all the diagnostic tests we need. It's that whole spectrum of care thing. We've been doing it for decades, and
Yeah.
we just have to go with what we have.
And I still say a good physical exam costs you nothing.
Yeah.
$3,000 for CT or MRI, absolutely. That can be done, but a good physical exam picks up so much.
Yes.
From tail to nose, or whatever you say.
Nose to nuts.
Nose to nuts.
If appropriate.
If appropriate. That's right.
So
You asked about aromatherapy.
Yes. Oh, I want to talk. Yeah, please. I want to hear about that. Because
Yeah.
I'm real sensitive to smells. Like potpourri, I get like allergic from it. So how does that work with you?
Well, fortunately, very, very well. We've got a number of companies that produce products, both topical and oral, and one inhaled product that we use a ton of for respiratory disease, that are safe for pets. We can rely on their quality. They're not harmful to dogs or cats. We always have to worry, about cats, but always we ask the client if there's anyone in the household that are sensitive to smells. So we just, I always keep open bottles so that the client can sample it and make sure that no one's going to be offended by the scent. But we use a ton we have a topical that's great for arthritis and pain. Again,
Cool.
I just sent out some of the aerosol goes in a diffuser, like a humidifier, an essential oil diffuser, yesterday for a dog that's got a throat tumor, and he's having respiratory issues secondary to that. And so this will ease his breathing.
Yeah. It's amazing to me because I was reading in JAVMA about cats that have a high potassium because they're blocked, that urinary tract are blocked, and that they use albuterol inhaler for that.
Yeah.
When did that start? We didn't learn that.
No, we did not.
And the other thing, I graduated in 89, you graduated in 88. We never met in vet school. You know what I'm saying? Because I think you were so much around your own class members.
Yeah.
You didn't, and of course, the residents.
Yes.
Because you were like always working for them.
Yes.
But when I saw that you graduated in 88, I'm like, damn, we never met. That's right. Yeah. Did you go to undergrad at Ohio State?
I did.
Oh, you did. So you're like a Buckeye through and through, except then you went to your residency was at Minnesota.
Yes.
Boy, that could only be colder than where you're at now.
It was a bit of a shock.
There's Miss Libby.
All right.
Now she's from Golden Treasures. She was an Amish breeding dog who escaped, hit by car, found her laying in a field. And
fixed by Dr.
FHO by Dr. Day. Mark Day fixed her hip. Well,
So did you bring up albuterol?
yeah, why?
Because my
Oh
son.
God, what? You were on it.
No.
It all circles back to you.
It circles back to me. I have the 2-year-old's head right here, and he's sucking on that, whatever they call that vaporizer thing. You know what I'm talking about, that thing? And I'm literally like breathing it in, and I'm getting higher than a kite.
Oh.
And I'm like, why am I feeling like this?
Neal, I have to tell you, in general practice, when we're doing spay and neuters, I used to get the worst headache from the escaped gases from the anesthesia machine. honest, that's how sensitive I am. I mean, the worst headache ever. Yeah, it was
You
horrible.
smell it?
Yeah, because they have a rescue system from it, but they all leak.
How
Well,
about
I shouldn't say that. Yeah.
how about formalin?
Oh, tell me about it. And, doing skin biopsies, we always put them in formalin, but
Yeah.
yeah,
I mean,
you're
from
right.
anatomy, you had to have really.
Oh, that was horrible.
Yeah.
Yeah.
So, Neal, I have a question. Do you often have patients that know it's making them better? Like they're kind of like they come in and go, have at it. Do you know what I mean? Like
Oh,
they
you mean not the owner, the
not
dog
the
or
owner,
cat?
the
Yeah,
pet.
that's a good question.
We're fortunate that we only do the things that we've talked about. So we're not doing vaccines or anything uncomfortable. So that's one plus that we have. The other plus that we
so
have
they
is that
know.
we're low volume. We've got 4 rooms. We're
Right.
seeing a patient every half hour, so there's not
Yeah.
a lot of extraneous barking or that sort of
Right.
thing. It's low stress. We've got music going. We've got the
Yeah.
essential oils. So we've created that environment. And the cool thing is, we get a patient in the second or third time, and they know where they're going. You know,
And they know
Good-
it's pleasant.
Yes. So it's very
Okay.
heartwarming to have the client say the dog is running in the door when they don't do that other places, which is
So
nice.
what's on your playlist?
Well, we used to do Susan Wagner's
Yeah.
through a dog's ear. So we rely on that because
Really?
that's scientifically tested, and she's a classmate, so we kind of support
Is
that.
she?
Yes.
Did not
she
know
was,
that.
Yeah, she was a
I'm gonna
class
look
of 88.
that up for
The
Miss
name
Libby.
sounds familiar now that you say it.
She
Oh my
was,
God.
She was, she did neurology at MedVet and at OSU.
Yes.
Yeah.
Yes, Sue Wagner. Oh my gosh.
Yeah.
That takes me back. Wow.
But,
See, the problem, Neal, is most people that we graduated with, they're either retired or we've lost track of them.
yeah. Yeah.
Okay, so
more
I
and
gotta
more.
ask. I have to ask our guest question. We've already asked him a real guest question, but here's your question.
Uh-huh.
What do you think animals teach us about healing that humans tend to forget?
I think they don't put a lot of stock in that they're not saddled with their diagnosis.
Yeah, you're right.
And they're not going on Dr. Google.
Right?
Yes.
Right.
That's the whole reason we're doing this podcast, is
Yeah.
to correct all the myths from Dr. Google. Do you have pets? I can't remember.
Oh yes, we've got.
What do you have?
Well, we've got 4 cats at home, 4 at the office. We're down to 4
Yeah.
at the office. We've got 2 pit bulls from the Cleveland APL. Yeah.
So you
Oh,
have
good for you.
You have 10
Oh, good.
pets.
Well,
That's so
my
nice.
wife would prefer that I divide it up like that and say that there's 4 cats here and 4 at the office and 2 dogs that go back and forth. Now, if
We
you want
had
to do the
2
addition,
office cats.
you can do the addition if you like and come up with
Yeah,
that
right.
final number.
We get it. We get it. We had 2 office cats, Big Jerry and Little Jerry. And
They used to look out the window at you.
I
when you were at
know,
your
from the
restaurant
top window
across
there.
the street.
I help out Richland County Humane when I'm in Ohio, in Mansfield. And they lost Bowman, their one-eyed office cat. And I sent them an email. I said, look, no one understands when you lose an office cat. It's your family.
Yeah.
You look, every day you come in, it's like, hey, they're happy to see you. And it's just such a loss, Yeah.
Our problem is that we've lost 2 office cats in the last 6 months, and we don't, of the 4 remaining, we don't have a kid-friendly one.
Oh, yeah.
So we're going to have to wait for the Feline Distribution Network to bring a
Yeah, you are.
a kid-friendly cat. You got to
Yeah.
have one in the office.
The 2 that I adopted that I took home, because Big Jerry and Little Jerry was from Hinckley Animal Hospital and Big Jerry was from Memphis. But the ones that I adopted and took home, 3 doors down, there was a rental from my office.
Yeah.
And a mama cat had kittens in the window well.
Oh my God.
And so I managed to get those kittens. I couldn't get the mom. Because, there's those 20 acres behind our office.
Yes.
So people would dump cats all the time.
Oh
Yeah.
my gosh.
I think they made their way over to your place. I seriously do.
Yeah. We just lost one that we had inside for 10 years. He was outside for 4. And we were feeding him, and Vinny at the auto repair was feeding him as well. During his outside time.
Yeah.
It took us 4 years to catch that guy. Yeah.
Oh, yeah. I believe it. So you made him an indoor cat. You must
Oh,
have
yeah.
done something right.
As soon as he stepped in, he never left.
Oh.
He was great. Yeah.
Once they get a taste of that couch.
Ours won't go out in this weather.
Yeah, I don't blame them.
Hunkered down. We have like cozy blankets everywhere. They will go to the door and go,
Not me.
They won't go out.
Yeah. Well, we should wrap it up. I've got to go rescue those iguanas that have fallen out of the trees because it was 39 degrees here.
And I got to go look at the demo downstairs. Oh my God.
Yeah.
We just found out.
We can't thank you enough. I always
you're
learn
welcome.
so much from you. I really do.
It was great seeing you guys again.
Yeah, great seeing you. And keep warm. And keep those cats warm. The 4 that are outside, you have little cat houses?
No. Everybody's inside.
Oh, they're in. Oh, good.
Yeah. I mean, we feed some here at home outside, some ferals, and we feed some outside too. You know, in Richfield, they come around.
Yeah.
So
you got to. Where else are they going to eat?
Yeah.
You know?
Well, thank you. This has been so helpful and informative. Thank you.
Oh, you're welcome. It's great to see all of you.
Golfers always swing for the greens, but they don't always hit them. Every year, millions of innocent golf balls are recklessly sliced, chunked, and hooked without any consequence. Golf balls can have a significant impact on the environment if not properly removed from ponds and water hazards, harming aquatic life, contaminating water, disrupting habitats, and aggravating golfers. Plus, golf balls do not biodegrade and can take 100 to 1,000 years to break down. Once they do degrade, they release microplastics, zinc compounds, and rubber fragments. That's why Froggy's Golf Ball Retrieval Service is so valuable to the sustainability of golf courses throughout the Midwest. Froggy's efficient retrieval system helps reduce environmental contamination, waste, conserves resources, and enhances the golfer's experience. Plus, they offer financial benefits. Froggy's pays per ball for any golf ball pulled from your ponds, no matter the condition. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game.
Hey, thanks for watching.
And listening.
We like likes.
Don't forget to like, share, and subscribe. You can follow us on social media at Speaking of Pets.
And give your pets a big kiss from the Novotny sisters.
This episode of Speaking of Pets has been sponsored by Froggy's Golf Ball Retrieval. Don't use a mulligan. Let Froggy's clean up your ponds while the golfers clean up their game. The Speaking of Pets podcast is an SLA video production.